Well, pelvic organ prolapse, big word, but it affects millions of women, and it really can often go undiagnosed.
The symptoms of this condition can be severe, and it's important to know the warning signs and the causes.
Yes, we're speaking with Dr. Elisabeth Sappenfield. She is the medical director. She's also a board-certified urogynecologist at Hartford Hospital and is here to tell us more about this. Thank you, doctor, for being with us. Can you explain a little bit more about what pelvic organ prolapse is for those who don't know?
Yes, absolutely. Thanks for the welcome, Karen, Nicole. So pelvic organ prolapse is where the organs in the pelvis, like the bladder, the rectum, or the uterus, they drop or they shift from their normal position. Feels like a bulge or something falling out of the vagina. It's pretty uncomfortable.
Yeah, it sounds it. And what are the most common causes of this?
So this is caused by, childbirth, aging, menopause, genetics. It can run in family. Sometimes it can be contributed by chronic constipation, obesity, heavy lifting, or prior surgery.
So if you're wondering if you're suffering from this or you need to get some help, what are the signs and symptoms of pelvic organ prolapse?
So a lot of times my patients will tell me they feel a pressure or fullness in the pelvic area or the vaginal area. Sometimes they feel a bulge or a lump that's coming out, or like there's something there that's falling down, but there shouldn't be anything there. A lot of times women will have good days and bad days, but typically they'll notice that it's more bothersome than they've been active on their feet, doing a lot more lifting, or at the end of the day.
And how do you typically treat a condition like this? What are the latest options out there?
There's a lot of great options for treating prolapse. So either women can use a pessary, which is a device that they put in and take out of the vagina, or there are some surgical options that can be done either vaginally or minimally invasive. This can be done with or without removing the uterus, and it can be done with or without mesh. So there are a lot of good options out there for women.
Okay, and if you're thinking, gosh, I really want to know more about this, but you're not sure how to get more information, you actually have an event that can really be helpful. I know sometimes women might be shy about asking these questions. Tell us a little bit about what they can learn at this event.
Absolutely. So on December 3rd, Tuesday at 6:30 p.m., I'm going to be talking more about it, about the in-depth details of what is prolapse, what does it feel like, and then what can we do for you going on from there.
All right, and that's a virtual event, so make sure to register if you have any questions. Thank you so much, Dr. Sappenfield, for coming on the show and talking to us about this.
Absolutely. Thank you for welcoming me.
Thank you, doctor. Again, for all this information, it's free. You just go to hartfordhealthcare.org/events. Registration is required, but it is free. So there you go. And here's a look at what we're working on for